Hi, hello and welcome to this video on OET Speaking. You all know that your OET Speaking is assessed based on two broad categories of criteria, linguistic criteria and clinical communication criteria. Now, linguistic criteria is purely based on your language proficiency, whereas clinical communication criteria takes into account a lot of other factors such as how you build rapport with the patient, then how effectively you deliver information, how well you gather information, and so on. Even if a candidate's fundamental language level or fundamental English is not up to the mark, he can score well. He can score well in OET Speaking if he pays attention on certain minor aspects of clinical communication criteria. And it's easy to score when it comes to clinical communication criteria. Now, in this video, we are going to specifically look at one clinical communication criterion, that is information gathering. Why information gathering is important in a real scenario, in a real healthcare setting. It is very important that you rightly or appropriately get the information from the patient so as to ensure that you are delivering the right kind of service or care to the patient. Now, that's in the real healthcare setting situation. Just like that, when it comes to OET Speaking, information gathering includes a lot of points or steps to be included so that you get good marks for your information gathering criterion. There are a few steps that you need to keep in mind to ensure that you get good marks for this specific criterion. In this video, we're going to see what are the steps that we need to carry out, or what are the factors that you need to keep in mind so as to ensure that your information gathering is perfect. The first step is facilitating patient's narrative with active listening techniques, minimizing interruption. Now, in information gathering, what happens? You ask questions to the patient and get information from them. It can be regarding symptoms, it can be regarding past medical history, it can be regarding the management the patient would have probably already taken. It could be anything. Basically, getting information from the patient. That is what is information gathering. So you ask questions and find them out. It's not just enough that you get the information. How you get it? There's a way to it. That is what is discussed in this assessment criterion. Now, the first step that you need to keep in mind is that facilitating patient's narrative with active listening techniques and minimizing interruption. Now, minimizing interruption means once the patient starts speaking, you should not interrupt in between. Wait for the patient to complete. To maintain that respectful attitude, you need to wait for the patient to complete and then you start speaking. That is one thing that you have to ensure when it comes to information gathering. You should not be in a hurry to get details from them. When they are speaking from their side, make sure that the patient completes what he or she is saying and then you start speaking. That is one thing, minimizing interruption. And you should also employ active listening techniques. Now, what do you mean by active listening techniques? You would be listening to the patient, but you have to make the patient feel that he or she is being heard. You can do that by employing these active listening techniques. These are minor aspects that you can easily use while doing your speaking, and you can get scores. You can get scores for that. Now, first one is use of silence and pausing. That is to minimize interruption. You need to remain silent when the patient is speaking, and you have to pause your speaking until the patient completes his side. Now, the next thing is verbal encouragement or back channeling. Now, what do you mean by verbal encouragement or back channeling? What do you have to do? That is, as the patient speaks, you have to give responses like, okay, all right, go on, okay, I see. Just nuances or just minor responses to make the patient feel that, okay, you are listening to him. So this is one technique that you can employ as part of active listening. Verbal encouragement or back channeling, we call it. Normally when we listen to somebody and if we are interested in that conversation, we'll be doing that, right? Oh, I see. Okay. And then same way, you have to show that interest while the patient is speaking so that the patient feels that he is being heard. Now, the next technique is that echoing and repetition. Now, does that word tells you something about what has to be done? Echoing and repetition. It's nothing, very simple. When the patient says something, you just need to repeat the same word. That also indicates that gives an indication to the patient that you are listening to the patient. For instance, if the patient says, I feel scared, the nurse should be saying, scared? Okay, so the patient understands that you are in line, you are in track. Another way is paraphrasing and interpretation. Now here we use the same word as the patient would have mentioned while he's speaking. When it comes to paraphrasing and interpretation, you're not using the same word, you're paraphrasing. You're using a different word and you are interpreting or understanding what the patient has said. Again, that gives a confidence to the patient that, okay, the nurse is actively listening, or the nurse is really actually listening to what I'm saying. I'll give you an example how to do that. Now, when the patient says, I'm unable to cope with the situation, the patient says, I'm unable to cope with the situation, and the nurse can respond in this way. I can see that you are having a hard time managing everything that's going on. When the patient says that, I'm unable to cope with the situation, the nurse is responding to that using the same idea, but just paraphrasing it by saying that, I can see that you're having a hard time managing everything that's going on. So, as part of this facilitating patient's narrative with active listening technique and minimizing interruption, we need to ensure that we use active listening techniques like this back channeling, echoing, and then paraphrasing. And also we need to ensure that we minimize interruption. We need to keep silent as the patient is speaking. Now, this is the first one. The second point under information gathering is that using initially open questions and appropriately moving to closed questions. Now, what do you mean by open questions and closed questions? Open questions are nothing but it gives an opportunity to the patient to express his perspective or his story completely. When you ask open-ended questions, you are giving a wide range of possibilities to the patient to give answers. But at the same time, if it's a close-ended question, you're just narrowing it down. The answers can have only two possibilities, either this or that. So you should not restrict the patient's communication like that. Instead, what you should be doing is that you should allow the patient to express his perspective or express his whatever idea, whatever is there in the patient's mind completely and fully. For that reason, initially go for open questions, and then gradually, if you want, you can come to closed questions. I'll show you an example. Now, do you have nausea or vomiting along with the headache? Now, that's a closed question because you're directly asking, do you have nausea or vomiting? So, what are the possible answers? Yes or no. Either you say, yes, you have nausea, or you say, no, you don't have. But at the same time, if you ask it as an open-ended question, how it would be, could you please tell me if you had any other symptoms along with the headache? So you're generally giving that freedom to the patient to express himself completely. You're asking what other symptoms do you have, or what other symptoms probably you noticed along with headache. So if the patient had nausea or vomiting, definitely he would say that. Now suppose if the patient only had nausea. So you ask, did you notice any other symptoms along with the headache? And the patient says, yes, I had nausea. Now in your role play card, inside the bracket nausea, comma, vomiting is given. In that situation, the patient had mentioned only nausea while saying, then you can specifically ask about vomiting. Did you have vomiting? That close-ended question is fine. But initially you should start off with open-ended questions, and then only you have to move to close-ended questions. I hope that's clear. Now another situation. Do you exercise regularly? That's a closed question. Do you exercise regularly? The patient can say yes or no. But at the same time, if you want the patient to answer flexibly, freely, then you should be asking, can you tell me about your exercise routine? You're asking a general question, allowing the patient to speak in general about his exercise routine. Then, is the pain sharp? Is the pain sharp? If somebody asks you, is the pain sharp? If the pain is sharp, you'll say yes. If not, you say no. But at the same time, but the patient feels that, oh, if the question is like that, I can either say yes or no. But in the patient's mind, the patient might be having some other idea to express regarding pain. So the patient can do that only if you ask the question like this. How would you describe the pain you're experiencing? If you ask the question in this way, of course, the patient can say that, okay, I have a very sharp shooting pain which comes and goes. So he's completely describing how the pain is. But at the same time, when you ask, is the pain sharp? You are allowing the patient to only say yes or no. So keep this in mind. This is the second point. Start with open questions and then move to closed questions. Now the third point, not using compound questions or leading questions. You should not be using compound questions or leading questions. Now what do you mean by compound questions? Compound, as the name indicates, there will be multiple questions in one question. So you should not do like that. It will be confusing the patient. The patient will not understand to which question I should answer first. So you need to avoid such a situation. Avoid compound question. I'll give you an example. Have you ever had chest pain or felt short of breath? So you're asking two questions at a time in one instance. Have you ever had chest pain or felt short of breath? So that actually confuses the patient. Instead, you should be splitting and asking it as two separate questions. You can ask, have you ever experienced chest pain? You get the answer and then you go for the next question. Have you ever felt short of breath? So avoid compound questions and also avoid leading questions. Now what do you mean by leading questions? I'll show you an example, then you probably understand. Leading questions. You're asking, the nurse is asking, you have lost weight, haven't you? So leading questions means in the question itself you have an assumption and you're actually trying to lead the patient towards that answer. You've lost weight, haven't you? You're asking a question based on an assumption. Such kind of questioning should also be avoided. You should not ask leading questions. Instead, how you should be asking, have you noticed any changes in your weight lately? So you're making the question very general without being leading towards or inclining towards one specific idea. Okay, so the third point, this also you need to keep in mind. Avoid compound questions and leading questions. Now the next point, clarifying statements which are vague or need amplification. This is also an important step of information gathering. It's not just important that you collect information, you allow this patient to express completely by asking open-ended questions. You did not ask compound or leading questions. All those are fine. But you have to make sure that whatever information that you've got is clear. In situations, if you feel that the idea which the patient has given to you is vague and you feel like you want to know more, you should definitely go for clarification. If you feel you need amplification, then you have to ask further questions. That is what you mean by clarifying statements. If whenever the patient's response is vague, you need to ask further questions to get clarification. I'll show you. The patient says, I feel dizzy. Patient says that I feel dizzy, that's it. Now if the nurse feels that, okay, what exactly the patient was feeling, the nurse needs to know, then the nurse should be asking, when you say dizzy, do you mean that the room seems to actually spin around? Because the nurse wants to get a clear picture of what the patient had experienced. So for clarification, the nurse has asked a clarifying question or a statement there. This is also an important part of information gathering. One more example. The patient says, my stomach never feels right. You understand that, okay, the patient is having some sort of discomfort, but you need to have clarity on that. Again, you can go for a further clarification. The nurse can ask, could you describe more about what you're feeling? The patient just said that never feels right. So you are asking, could you describe more about what you're feeling? Is it a cramping, bloating, pain, or any other discomfort? You want to make it clear, so you're asking further questions. This is also very important aspect of information gathering. So far we have seen 4 different aspects. The first one was using active listening techniques and minimizing interruption. Then the second one was beginning with open-ended questions and then moving on to close-ended questions. Then the third one was not using compound questions or leading questions. And then the fourth one, clarifying if the response given by the patient is not clear or if the response is vague, go further with clarifying statements. Now, One last point. Summarizing information to encourage correction or invite further information. Actually, I would say that this is one of the most important steps when it comes to information gathering. That is, you collected all the necessary information using the right techniques, and you also asked questions to clarify any uncertainty or any lack of clarity in what the patient had replied. Even then, the information gathering step is not complete. You need this crucial step as well to get that complete circle of information gathering. Now, what is it? Summarizing information to encourage correction or invite further information. That is, once you get all the necessary information from the patient, you need to summarize and repeat it back to the patient. Why are we doing this? Actually, there are two purposes for it. One is to encourage correction or invite further information. That is, you're giving a chance to the patient to correct himself if in any of the information that he has shared, or if the patient feels like, okay, he needs to add on information to the already given information, you're giving the patient a chance by summarizing and repeating back the information. I hope that is clear. Through this example, you'll understand it. Now, the patient would have shared, the patient would have said, for the past 2 weeks I've been experiencing indigestion, and at times I have headache for a few hours, and through medication that gets relieved. I feel that then you would have asked, what do you think might probably be the cause of indigestion? And the patient would have said, when I eat rice for dinner, I feel indigestion. So you got different details, like you would have asked separate questions. That is, for how long you have been experiencing this? The patient would have said, past few weeks. Now, did you notice any other symptoms accompanied with this? So the patient said it is accompanied by headaches, and which lasts for a few hours. And do you take any medications? Then the patient would have said, yes, it is relieved with medication. Then the nurse would have asked, do you specifically notice this indigestion when you eat any certain specific types of food? So the patient would have replied, yes, when I eat rice for dinner, I notice indigestion. So you collected all of these information. Now, it's not, you should not stop there. Okay, you should not move to your next task. The information gathering will only be complete if you summarize all what you have collected and repeat it back to the patient to ensure that nothing has gone wrong. And if the patient wants to add on to the already provided information, he can do that. So how will you say that? This is the summary, okay? Now this is the summary. You will be saying, from what I have understood so far, you have been experiencing indigestion for the past few weeks, and at times it is accompanied by headaches which last for a few hours and are only relieved with medication. You feel the indigestion is caused when you eat rice for dinner, and you have to check with the patient, is there anything else that you would like to add? So through that question, you're giving a chance to the patient to add on any missed out details, or else you provide the summary and then you can ask, is there anything that I have missed? Did I miss out to include any information that you have shared? Or else you're just verifying whether everything is fine. So for that you can ask, is that right? So this is how you summarize and repeat it to ensure that everything is right. Whatever information you have gathered is right and complete. You have not missed out anything. These are the 5 steps that you need to keep in mind to ensure that your information gathering or information collection is appropriate and accurate. I hope you found this video helpful, and next time when you do your OET speaking, you would be employing this technique and just see how your scores get boosted. Thank you and stay tuned until we meet through our next video.
Medcity International Academy. Trusted hands forever.